Hey, this is Marty Stepniak, senior writer for Hospitals and Health Networks magazine, and I'm reporting to you from HIMSS 2016 here in Las Vegas, and I am joined by Joe Colorafi, who is Vice President and Chief Medical Information Officer with Dignity Health in San Francisco. Joe, thanks for being with me today.
You're welcome. It's my pleasure.
Could you just start by sort of teeing up this issue and telling us why sepsis has been such a pressing problem for Dignity?
Well, severe sepsis is a big problem across the world. It is responsible for tens of thousands of deaths in the United States per year. And unfortunately, if you get severe sepsis, there's many types of milder sepsis, but if you get severe sepsis, or the most serious sepsis, what's called septic shock, your risk of mortality, of dying from that, despite all of the technology and all the knowledge that we have about treating it, can be up to 40 to 50%.
And I understand Dignity has developed a sepsis biosurveillance program to help address this issue. Could you tell us a little about that and what that is?
Well, the stars became aligned about 2 years ago when we were able to secure a big data platform in a 5-year partnership we have with SAS Analytics. So we knew we would be able to stand up a state-of-the-art Hadoop data warehouse within about 4 or 5 months, and we did so by the end of 2014. And since that point, we've been able to think of projects of great value, and biosurveillance sepsis is one of those projects.
Could you give us more of a sense of the nuts and bolts and just a few of the key things that you've put in place to help bring down the sepsis rates?
Right. So the program is end to end. It's an ecosystem. It's just not a smarter alert, as I tried to describe. It's not only the state-of-the-art knowledge delivery through our data warehouse and what's called visual analytics, which is really a dashboard that is intuitively easy to read for the goal owners. It's also about the people in the process and how to use that information, and then create that feedback loop into defining how we take back how we deal with sepsis. And we have governance. We have an ICU council and what's called a clinical consensus group, which manages severe sepsis. And so we're working very closely, as I said, with that campaign to improve our outcomes.
And what have the results been? Have you been able to move the needle to the degree that you wanted to?
Well, we initially had a couple of pilot sites which had some limited data, but we've now been up at 12 sites for 1 quarter. So we like to compare quarter to quarter, but a year back, so that we have a seasonal adjustment in that. In fact, sepsis has its highest incidence during the winter months in the Northern Hemisphere. Because it's highly related to different types of infection like pneumonia and flu and things like that. And so we have now about 450,000 cases in our data warehouse with that larger number of facilities. And we have been able to see some positive results in 3 areas.
What are the 3 areas?
In the 3 areas are, number one, that we reached our goal of providers responding to the alert within a goal rate of less than 120 minutes. We started out at about 210 minutes, and we're able to half that and reach that goal. Again, the quicker the doctors can act on severe sepsis, the better the outcomes, the lower the mortality. We're able to show that we decreased our ratio of severe sepsis to all sepsis cases at all of the biosurveillance facilities as well.
That's great. Just in closing, Joe, any advice you'd offer to your peers, other CMIOs who are grappling with the same problems of sepsis at their own systems?
Well, it's adoption of the new knowledge. People call it technology, but it's really the new knowledge. And just because it's a pretty dashboard and we're able to deliver a lot of more information in real time, they still have to understand it. We make a point actually not to just roll out the dashboard and trade them on the knowledge delivery system, but actually go physically out to the sites when we do our biosurveillance go-lives. And so we answer their questions. We develop a situation where they can ask questions. They can challenge us, with the data and so forth, so they understand it. Because we want them to own that process at their own facility.
Joe, thanks so much for being with me today.
Pleasure. Thank you.
For HNHN, this has been Marty Stepniak. Thanks for watching.